According to the World Health Organization, about 58 million people are infected with the hepatitis C virus, of which about 1.5 million per year have acute hepatitis C. And most of them ultimately develop chronic hepatitis C among children and adolescents. The number of patients with chronic hepatitis C is 3.2 million people. The World Health Organization estimated that approximately 290,000 people died of complications from chronic hepatitis C in 2019, mostly from cirrhosis and hepatocellular carcinoma. Patients with acute hepatitis or chronic hepatitis C may experience symptoms such as nausea, weakness, muscle or abdominal pain, and headache. Neuropsychiatric disorders, such as depression, weakness, irritability, and malaise, are also described in both acute and chronic hepatitis C virus infection. But chronic hepatitis C can be asymptomatic in most cases. And severe disease can have few symptoms, despite the development cirrhosis or hepatocellular carcinoma, therefore, in addition to specific markers of the hepatitis C virus. It is necessary to detect the degree of damage, fibrosis or cirrhosis and the speed of formation of this process. Chronic viral hepatitis C is typically characterized by a very slow course of the disease. The progression from stage 0 fibrosis, absence, to stage 4 fibrosis, cirrhosis, develops in most cases in about 0.1 to 0.15 METAVIR points over a decade. The median development of cirrhosis and liver decompensation in patients after transplant infection is 9 to 12 years, compared to the primary infection, which takes 20 to 30 years. Therefore, now the correct assessment of liver fibrosis is the main feature for evaluating an individual treatment plan for people with chronic hepatitis B or C. However, there is a lack of accuracy, availability and ease in the practical application of the fibrosis assessment method. There are still great limitations in practical application in adults and children. Liver biopsy is the gold standard in assessing the stages of fibrosis in these patients. However, biopsy is an invasive method and there may be errors in taking the liver biopsy, as well as different variability in the assessment of the liver sample. In order to evaluate fibrosis, a non-invasive hardware method of transient elastography is used, which showed better results in the diagnosis of late stages of fibrosis and cirrhosis compared to the calculated biochemical test FIB4. The disadvantage of the FibroScan device in comparison with the use of serological markers is that it is more expensive, less sensitive in the diagnosis of low and moderate liver fibrosis. Therefore it is not used in all even specialized clinics. And the last drawback, hardware elastometry using a shear wave of the liver fibrosis assessment function, which is built into the ultrasound sensor, cannot assess dystrophic and inflammatory processes in the liver, which is important for a doctor, because it is necessary to assess not only the result of inflammatory processes in the liver, fibrosis, and the speed with which it is formed, the degree of dystrophic and inflammatory phenomena in the liver. The results of the conducted research showed that publicly available biochemical and laboratory indicators are closely correlated with the morphological characteristics of the liver of patients with chronic hepatitis C, and the values of these indicators are not always outside the normal range. To determine the significance of indicators, it is necessary to take into account the dynamics or evaluate groups of indicators in a complex mathematical processing of the obtained data made it possible to obtain formulas for non-invasive determination of the index of histological activity and fibrosis based on the use of available laboratory and biochemical indicators. FibroTest, France, and FibroLiv, Ukraine, have a high rate of 100% concordance with biopsy. But the vast majority of those that differ have a deviation of only 1 point for fibrosis in the METAVIR modification. This confirms the high affinity of FibroTest, France, and FibroLiv, Ukraine, of the gold standard of fibrosis diagnosis, liver biopsy. Foreign commercial biochemical non-invasive tests for the diagnosis of fibrosis and hepatitis activity known in Ukraine are expensive and have their limitations in use. The result of the work was the computer program, FibroLiv&AktiLiv. The test allows the majority of patients with chronic hepatitis C, who cannot undergo a puncture biopsy of the liver, expensive fibroscan, liver elastometry, expensive foreign minimally invasive biochemical tests, to determine fibrosis and the rate of cirrhosis formation. The FibroLiv&AktiLiv program in practice allows you to monitor the rate of progression of cirrhosis, fibrosis and the effectiveness of treatment of hepatitis and liver cirrhosis.